Senate Bill 1135 establishes a pilot program for the cardiac screening program for youth grades 5 to 12. How many of you have heard along the lines of an otherwise healthy kid dropping dead on a basketball court? Those kids normally are found to have suffered from sudden cardiac death due to an undiagnosed heart condition, meaning it was likely preventable. The pilot program established under this bill will expand the number of cardiac screenings done by nonprofits throughout the state, resulting in more children being diagnosed earlier and making it possible for them to seek treatment. These screenings offer each student that chooses to participate a cardiac risk assessment of warning signs and family history and a 12-lead electrocardiogram. Importantly, 50% of the students that are found to have heart conditions pass their assessment without any concerns, but then were found to have irregular ECGs. That's so many lives that can be saved by a quick, non-invasive ECG. Before I turn over to my witnesses to share their personal experiences, I did want to mention that we are working with the CMA to tighten up the language to make sure that an appropriate physician is interpreting the ECG results. These nonprofits already partner with cardiologists to interpret the results, so we just want to make sure that the language is clear. With that, Madam Chair, I'd like to turn over to my witnesses to hear how this has affected their lives personally.
Very good. Thank you, Senator Jones. All right, looks like we have three folks who are going to testify. Two folks are going to do 1 minute, and then the last person who's calling in is going to do 2 minutes. So we have Rena Paredes Greason and Hector Paredes. So Rena, we will start with you. You have 1 minute. Please proceed.
Good morning.
Good morning.
My name is Rena Paredes Greason, Eric's mom. Just about 1 month from today marks the date Eric would have been 28. Instead, he was lost at age 15 to a heart condition no one knew he had. This beautiful kid, so full of life, always ready to play, who loved to dance and wanted to make the world a better place. But he never got the chance. This happened because of a tremendous gap in preventative heart care for our kids, which stems from a lack of education about the reality of sudden cardiac arrest in youth, known as SCA. Half of youth stricken have no warning signs or family risk factors. And of youth who did show symptoms, they were often missed or misdiagnosed because no one realized it was life-threatening. I am a nurse and I did not know. Studies show 1 in 300 youth has an undetected heart condition that puts them at risk. It's time to educate ourselves about how we can do a better job to protect young hearts. We know we can, because our nonprofit foundation has provided nearly 350,000 free youth heart screenings, finding 239 with cardiac abnormalities serious enough to cause sudden cardiac arrest. Because of Julia's screening revealed inheritable long QT, mom and brother were found to have it too. That screening saved 3 lives. Miranda's heart condition was discovered at a screening when her doctor refused to test her after an incident of tachycardia. Kaylee's heart defect went unchecked as her swim team coach told her to push through the pain. And paramedic Scott Sherman thought he'd recognize a heart condition, but he missed Spencer's. He said, "Thank you for saving my son so I could enjoy him for the rest of my life," which is something I have not done. And that is exactly what SB 1135 is about.
Thank you. Thank you for sharing your story. Mr. Paredes, please proceed. You have 1 minute.
Good morning.
Good morning.
Thank you very much for this opportunity. Senate Bill 1135 will educate us about what we need to do to mitigate these preventable tragedies, and I do mean preventable. Of the leading causes of death in youth, accidents, homicide, suicide, cancer, heart conditions, the last one is the one we have the tools to prevent right now. The pilot will provide meaningful data to demonstrate the value to families in our health system of doing more, and along the way it will provide a life-saving service to California youth and their families. My name is Hector Paredes, and I'm Eric's dad. When we lost Eric, I just didn't lose my son. I lost a lot of our future. Our family will never truly recover. I'm retired after a long career with the California Highway Patrol. I coached a lot of sports, and I can't believe I didn't know anything about sudden cardiac arrest. That's why our foundation sponsors SCA prevention legislation, and we know it's making an impact. Training mandated by the Eric Paredes Sudden Cardiac Arrest Prevention Act has already educated over 240,000 coaches about cardiac emergency preparedness. Working in school communities has proven to be an effective means to boost health literacy and health equity in accordance with the CDC's whole school, whole community, and whole child collaboration. This initiative has become a national movement, recently evidenced by President Biden adding ECG screenings for new cadets in military academies to National Defense Appropriations Act. Working models for youth heart screenings in California already exist. This voluntary pilot is clearly executable, and the data is critical to identifying the benefits of removing the #1 killer on school campuses. Senate Bill 1135 will help give families and their kids the future they're supposed to have. Thank you very much.
Thank you, sir. Thank you for sharing your story. We will now go to the phone lines, and we have Jacob Lee, who is a student who was screened through Eric Paredes Save a Life Foundation. Jacob, are you with us?
Yes, I am.
All right, you have 2 minutes. Please proceed.
All right. Hi, my name is Jacob Lee. I'm 21 and a junior in college. I'm here today because in 2014 I attended a free heart screening in San Diego. Honestly, it wasn't the first thing I wanted to do, but what happened that day changed my life forever. My mom told me the screening would be painless and it would only take about an hour. She wanted to rule out any issues with my heart. Despite looking healthy and playing basketball for years, I was experiencing shortness of breath and a rapid heartbeat during exercise or sometimes even when I was at rest. We spoke to my pediatrician about these symptoms and I was prescribed an inhaler, but it didn't help. During the heart screening, I was given an ECG and met with an on-site cardiologist. He told me that I had a condition called WPW, one of the leading causes of sudden cardiac arrest. He explained that I would need surgery, but I would return to normal activities. All of the well-meaning people in my life had misdiagnosed my symptoms. I was 1 in 300 youth who have a condition that could lead to SCA. Because of that screening, my story didn't end like Eric's. Every year, 23,000 youth under 18 die from sudden cardiac arrest. More youth lost in car accidents and who are lost to suicide. I am here today because of a free and painless heart screening. Please support SB 1135. Thank you.
Thank you very much. All right, we will now go to anyone here in room 2100 who wishes to testify in support. Seeing no one, we will go to the phone lines. Mr. Moderator, can you please queue up anyone who wishes to express support for SB 1135?
Thank you, Madam Chair. And yeah, on the phone, if you would like to speak in support of SB 1135, please press 10. And we'll go to line 192. Your line is open.
Thank you, Madam Chair and members. Sarah Bridge on behalf of the Association of California Healthcare Districts in support.
Thank you.
Next, we'll go to line 247. Please go ahead.
My name is Tracy Cuneo. I support.
Thank you.
And we'll go to line 250. Your line is open.
Thank you, Madam Chair and members. Dennis Cuevas Romero with the California Medical Association. Support if amended. Want to express our appreciation to the Senator and his staff for working with us. Thank you.
Thank you.
And we'll go to line 246. Your line is open.
Hi, my name is Steve Bailey. I'm the principal at Madison Middle School in San Diego County. Tragically, we lost student Marco just a few months ago to sudden cardiac arrest and have since scheduled a free heart screen at our school in December. Please support SB 1135.
Thank you.
And we'll go to line 225. Your line is open.
Good morning. This is Allison Healy-Poe. My daughter Ryan was found at risk for sudden cardiac arrest in 2014 at a free heart screening and has since had corrective surgery. Ryan was a 3-sport athlete. She had no warning signs. Today, she is a D1 athlete at UC Berkeley. Please support SB 1135.
Thank you.
And we'll go to line 226. Your line is open.
Hi, my name is Serena, and I was found at risk for sudden cardiac arrest thanks to my mom learning about the warning signs and risk factors from the Eric Paredes Save a Life Foundation so she could advocate for my heart health with my medical provider. Please support SB 1135.
Thank you.
And we'll go to line 215, 215. Your line is open.
Hi, good morning. Noemi. I am in support of this. I also have had several of the students that I used to work with holes in their hearts. And this is going also for youth of this age bracket, but even higher because a lot of the concerns of these parents are that it might be exacerbated or exhilarated because of the vaccines.
Thank you, ma'am. Next caller, please.
And we'll go to line 228. Your line is open.
Hi, my name is Julia Kalos, and I am currently enrolled in a graduate program in medicine. I was found at risk for sudden cardiac arrest at a high school heart screening when I was diagnosed with long QT syndrome, and 2 of my family members were also diagnosed with long QT syndrome following my diagnosis. Your support of SB 1135 will save lives.
Thank you.
And we'll go to line 233. Your line is open.
Hi, this is Carson. I'm a junior in college studying nursing. I was found at risk of sudden cardiac arrest in 2015 at a free heart screening, and I've since had corrective surgery. Please support SB 1135.
Thank you.
And we'll go to line 249. Your line is open.
Hi, my name is Tanya. I lost my son Christian to sudden cardiac arrest one day before his 19th birthday. Christian's dad and I wish we had the opportunity to get him screened before he passed away. Please support SB 1135.
Thank you.
And we'll go to line 204. Your line is open.
Yes, my name is William Flores. I also lost my son to sudden cardiac arrest and wish we would have had these free heart screenings for my son prior to. So we're in support of SB 1135. And thank you, Senator.
Seeing none, Mr. Moderator, can you go to the phone lines and see if there's anyone who wishes to oppose SB 1135?
Certainly. And ladies and gentlemen, if you'd like to speak in opposition of SB 1135, please press 10. And Madam Chair, no lines in opposition at this time.
Bringing this bill forward. First, I want to acknowledge your loss, and but this bill, I want to move the bill, Madam Chair, if I may, and also just to know that the loss doesn't go in vain when we're able to do legislation like this and actually prevent it from happening in the future. So, thank you.
Thank you, Senator Dolly. Any further questions or comments? Seeing none, the bill has been moved. Would you like to close, Senator Jones?
Thank you, Madam Chair. And I just want to acknowledge yourself and the senators, your patience today and graciousness in allowing the testimony. I think it was important for these families to be able to share personally their experience. I also want to, in closing, sorry.
It's okay. Take your time.
I just want to recognize Rena and Hector. I have had the opportunity to work with them since I was in the Assembly, and I'm not sure if the 2014 date was the event that I attended at Granite Hills High School, or if it was another date. But we're going to be doing another screening in San Diego this weekend. I'll be there on Sunday morning. They're doing another one in June in San Diego, and I'm amazed at the people that attend these things. You know, I showed up. I don't know if it was probably a Sunday morning, and I showed up to the high school, and they've got hundreds of volunteers, and they've got hundreds of kids and their parents coming to take advantage of these screenings. And so we are making a very positive difference in people's lives today. So I thank you for that and ask for an aye vote.
Thank you, Senator Jones. Thank you for what you're doing, making a positive difference. We appreciate you. All right, the bill has been moved by Senator Dolly. Madam Consultant, please call the roll.
File item number 7, SB 1135. The motion is due pass as amended, but first amend and re-refer to the Committee on Appropriations. Leyva.
Aye.
Leyva, aye. Ochoa Bogue. Aye. Ochoa Bogue, aye. Cortese.
Aye.
Cortese, aye. Daly. Aye. Daly, aye. Glazer. Aye. Glazer, aye. McGuire. Han.
Aye.
Han, aye.
That bill is out, but we'll leave it on call for Senator McGuire. Thank you, Senator Jones.
Thank you, Chairman. I appreciate it.
All right, next.